Hi, my name's Ruth. I'm one of the physios associated with the Pain Project here at Lister House. I'm here today to talk to you about TENS. TENS is a machine that we use for drug-free pain relief. You can purchase these devices from Amazon for between £25 and £30. The device is an electrical device which uses low-level currents to stimulate your nervous system. TENS works by distracting your brain from the sensation of pain by overriding the signals from the pain. It also works at the spinal cord level by blocking signals of pain from reaching your brain. TENS also works by helping the body to release its own natural painkillers called endorphins. TENS in itself does not cure pain, but it does allow you to have periods where you're more comfortable to participate in activities, therapy and social and functional activities that you would enjoy. TENS can be used for all types of pain, including acute and chronic, and especially for arthritic pain. TENS isn't effective for everybody, and for some it may not be suitable, but it is worth trying the device, because if it does work for you, then it is a good, cost-effective and safe way of managing pain. It can also help you reduce your reliance on prescribed pain relief. TENS should not be used if you have epilepsy, if you have a cardiac pacemaker or other electrical device installed within your body. It should not be used during pregnancy, though can be used in labour. It should not be used by children or people with varicose veins or numbness in their skin. Positionally, TENS should not be used on the face or the throat. It shouldn't be used on the back and the chest at the same time. It shouldn't be used over broken skin or varicose veins, and it shouldn't be used in any area where you haven't got complete sensation. If you suffer from fibromyalgia and have multiple areas of pain, you should choose the area which is the worst pain or the most central pain to use the device. Initially, when trialling TENS, we recommend that you try it for up to 2 months. You should try using it at different times of day, during, before or after specific activities, or regularly like you would take pain relief. This is a device unit. It's quite small and it can fit in your pocket just like a mobile phone would. It has different settings and different modalities that you can select. Majority of them will just vary depending on whether you prefer a continuous signal or an oscillating signal. Sometimes it will gradually get stronger or gradually get weaker. There are lots of different programs to choose from. I wouldn't worry too much about which one is right for you. Just try them out and see which one feels best. The device connects to your body via a cable and some electrode pads. I've drawn these diagrams on the board so I can show you how to position them. The pads are sticky and can stick to your skin. After you use them, you should put them back on the plastic backing that they come on so that you can preserve the lifetime of the pad. With a knee, I would actually use 4 pads. The device comes with 2 channels, A and B, for which you can use 2 cables and 4 pads. The idea would be to surround the knee with the pads diagonally across for one set, and then the other side diagonally for the other set. This will create an intensity of signal directly over the knee joint. For low back pain, we recommend not placing it directly over the spine, but either side. Like that. If you have pain that refers into one leg, you could put the pads as shown. You can also use 4 pads in this area, one either side of the spine and one more into the leg. For neck pain, it's a similar pattern. We're not going over the spine, we're just putting it either side of the spine. It should really be over the muscles on the either side of the spine or into the shoulder area. You can also use it coming through into the shoulder. As shown. For most joints, if you surround a joint with the electrodes, as I've shown you for the knee, you can achieve a good signal within the joint. Once the pads are in place, then you can switch the device on. Select a program and then increase the intensity of the signal until it is a comfortable level. You may find that after a short period of time, the intensity seems to ease off. In this situation, you can increase the intensity again. You should not have it so intense that it causes a muscle contraction or it is uncomfortable. You should maintain it at a comfortable intensity throughout the duration of the treatment. Each time you use TENS, you should probably use it for around the time that you're either doing the activity or for about 15 to 20 minutes prior to or following an activity. Try not to use it continuously over long periods of time, as this will reduce your tolerance for it and it will start to be less effective. Other precautions to take with TENS include not using it near water, as it's an electrical device. That includes over skin that is sweaty. You should have clean and dry skin. Try not to use moisturiser or any products on your skin prior to attaching the electrodes. Also, if your skin is particularly dry, it will reduce the lifespan of the electrodes. So perhaps moisturising when you're not using the TENS machine would be an option to help to extend the life of the electrodes. Another time that you shouldn't be using TENS would be when you're driving or operating machinery. If a pad were to become loose, the electricity will enter your body, but it will have no exit point, so it can cause a small shock. This is the reason why you should not be using it while operating machinery. All in all, TENS is a good strategy for pain relief and well worth experimenting with to see if it can work for you. If you have any further questions regarding its use, please contact your surgery or the physio that suggested it to you for more bespoke information about individual use.